Resample is a European project that focuses on people with COPD. The goal of Resample is to develop a technology that supports patients and caregivers. This technology will help patients manage their COPD and other chronic conditions. In the end, we want that Resample is useful and will be used in practice. But how should Resample be introduced in clinical practice? It is very important to look into this from an early stage. One way of doing so is to develop a service model. A service model is a representation of how technology and the whole service around it will look like in practice. The model describes who needs to do what so that Resample is optimally used in daily life. The people who have a role in Resample are called stakeholders. Stakeholders can be healthcare professionals, for example, the pulmonologist or the pulmonary nurse, or the patient with COPD who is going to use the service. Because these people are using Resample in the future, it is very important to involve them in the design process of the service model, so that we can include their needs and wishes. Rusing Research and Development developed the Resample service model based on 5 rounds of studies with stakeholders from 3 different countries: Italy, the Netherlands, and Estonia. This was very important because there are a lot of differences between the countries in terms of how care is organized. For example, in the Netherlands, pulmonary nurses spend much more time with COPD patients than, for example, a pulmonologist, while in Italy, the physician plays the most important role in their care. These are small details but very important to know when developing a service model, because otherwise there might be a chance that Resample doesn't fit with actual practice. Here you can see the final service model, which is based on all the conversations with stakeholders. It is important to mention that not all activities that are described in this model are already existing in practice. The service model describes how it should be implemented so that it's optimally used. In this service model, there are 3 different stakeholder groups involved: healthcare professionals, patients with COPD, and others. There are a couple of things that need to be done before Resample will be used by patients with COPD. The first step is that the patient with COPD has to know about its existence. Healthcare professionals or others can inform the patient about Resample, or the patient might hear about Resample from their own search, for example by reading flyers in the waiting room of their pulmonologist or by finding information online. When a patient wants to join, their care team ensures that they can do so and helps them to get started. For example, the patient gets information about Resample, gets introduced to the wearable, and fills in some questionnaires. The service model also describes the different parts in the app: the chat with peers, self-management and data collection. Both self-management and data collection contain different activities. For self-management, goal setting, education about COPD, action plan and coaching will all be included. For data collection, the monitoring will enable to see trends and progress and a risk overview. In this way, potential changes in usual symptoms can be early detected. If there are more symptoms than usual, there will be an option to ask healthcare professionals to take a look at the data. Additional tests may be needed, following with a consult to discuss the results and the next steps. Unfortunately, sometimes symptoms may be worsening, so that the patient with COPD might need to undergo treatment. After the recovery, the patient is invited to reflect on what might have caused the worsening. This can be very useful also for their self-management. There are a lot of different activities that can be carried out in the app. Without the help of stakeholders, we would not be able to understand the different responsibilities in each country. This shows again how important it is to involve stakeholders during the project. They are the experts when it comes to living with and managing COPD, and we are very grateful for their time. We learn a lot from them. What's next? The development of the resample solution is ongoing, and we will continue to involve end users so that we get feedback at different points in time. Only then we can make sure that we understood well what people need and that our technology is well developed. Would you like to be involved and sing along with the resample project? Please feel free to contact us. Thank you for your time and attention. The resample team of RRD.